Hello, my name is Josh Abecassis. I'm an assistant professor in the Department of Neurological Surgery, and I'm with U of L Health. I grew up in Chicago, not too far away, and my father was a transplant surgeon, so he specialized in liver and kidney transplants. And my mom was a neuro-ICU nurse, actually, and so they met when he was in training. I think I knew I wanted to do surgery, from watching him and his career, and I knew I wanted to be an academic surgeon or a surgeon scientist, one that also specialized in some sort of research. Then as I started medical school, I did some shadowing, and really the patient disease, the array of pathology that was treated by neurosurgeons is what kind of appealed to me and drew me into the field. I am a academic cerebrovascular neurosurgeon. So essentially that means I work on the blood vessels of the brain and spinal cord in some capacity or another. So you can have problems on any side of the blood vessel, from artery all the way to vein, and anywhere from the brain down through the spinal cord. And there are various ways to kind of address these problems and treat them. It's an academic position in the sense that I'm committed to educating the next generation of surgeons, and I'm committed to trying to push the field forward through biomedical research and collaboration with other people who are really smarter than I am. There's a lot of data, there's a lot of conditions, there's a lot of literature. People have spent a lot of time trying to understand these diseases, what's going to happen, what the treatment options are, and I do not expect any patient that comes in my office to know any of that. There's no reason that he or she should. So my first job is to just explain everything and what your options are and kind of, give my opinion. The next thing is I want to empathize with the patient. It's a really devastating event to hear that you have a disabling condition, or that you have a very serious problem that's going to need a surgery or a procedure. And so, and that really means something to me to try to really feel for the patient and understand what they're going through. And then third, my goal is to address it, and whether that means just watching something, with non-invasive imaging and just getting another scan in a couple months, or treating it minimally invasively, through the wrist or through the groin, or treating it with an open surgery. And central to that is I try to treat every patient like they were a family member of mine. So, if it was my sister or my wife or my son or something like that, that's how I want you to get the same treatment that I would want for one of my family members. I think I bring the unique perspective of having both complex open microsurgical skill set, but also minimally invasive. And I don't think one is better than the other. I think each problem has to be analyzed independently to figure out what the best fit is. My wife's from the Midwest as well, in Ohio, and I'm from Chicago, so we're really excited to be back. We've debated whether Louisville is considered the Midwest or the South, and it seems like a little bit of both. So we're excited to be here and just kind of get to know the town, and we're expecting a new baby.